Well, good morning again, everyone. So now we switch gears a little bit and are going to talk about the topic of diagnostics. And so GoEd has been spending a lot of time trying to understand our role in a diagnostic strategy. There we go. And so what we're going to do here is have a panel discussion and kind of an open dialogue. And we understand that you as an industry that diagnostics is a tool for educating consumers and increasing consumption, but there's been challenges in determining how to motivate consumers and how to move this conversation forward. So what we're going to do today is explore where we are with diagnostics through the lens of personalized nutrition, share some consumer research that GoEd has done on diagnostics, hear from companies that are involved in diagnostics on a daily basis, and really examine the obstacles that we need to overcome to really be able to move this forward. So this is meant to be an audience participation session, but we do have a presentation first that we're going to use to set the stage, talking about personalized nutrition broadly and talking about the consumer research that GoEd has done. But what I want to do, just to make it a little simpler, is I'm going to introduce all the panelists now, and then after the first speaker is finished, we'll have them all come out on stage, and then we'll begin more of a roundtable. So Josh Anthony is the founder and CEO of Lumen, which is a business-to-business personalized nutrition and health consulting company. He has expertise in personalized nutrition and testing from his previous role as Chief Science Officer with Habit. And we worked with Josh last year on this consumer research that I mentioned. And we also worked with him on the commissioning of a white paper on the state of Omega-3 testing broadly, which is going to be published shortly. We also have with us Marjorie Van Kauk, who is the Global Marketing Manager at Nestle Health Sciences Minami division. And she leads a project preparing a prenatal Omega-3 supplement with a testing protocol for pregnant women. Then we have Leyland Dogan, who's Vice President of Omega-3 testing company Omega-Quant, where he has spearheaded growth for the testing in global markets. He also has a great deal of experience with Omega-3 oils from previous roles at DSM and Aker BioMarine. And then lastly, we have my colleague Harry Rice, who's our Vice President of Regulatory and Scientific Affairs, and he's been involved in GoEd's diagnostics work over the last year. So for now, I will introduce Josh Anthony, and then we'll all come back and talk to you further.
Thank you, Ellen. I want to thank Ellen and the organizers for having me back here at GoEd Exchange. It's so nice to be here in beautiful Athens, Greece. 2,400 years ago, Hippocrates said, "In food exists excellent medicine. In food exists bad medicine. Good and bad are relative." Hearing that, in many ways, Hippocrates could be credited with being the first fan of personalized nutrition. But when I hear good and bad are relative, it makes me think of something else. How can you tell? How can you tell what's good for you and maybe bad for another? The answer is measurement. And that's really what this talk is about. It's about Omega-3 diagnostics and connecting measures to motivated consumers. The end goal being to find those consumers who are low in status, and we know that's a widespread problem, and encourage them to take more supplements or improve their diet and ultimately improve health. And I think that's a goal that we can all get behind. The talk that I'll be sharing today is really divided into two portions. The first part is some original research that was conducted by Lumen, looking at 3,000 consumers that are interested in and practicing personalized nutrition and personalized supplement regimes. The second part is GoEd-sponsored research that is really focused on Omega-3 diagnostics across 5 different countries. I want to recognize Katie Cleary, who leads insights for Lumen, and Barbara Winters, a scientist for Lumen that I partnered closely with on this research. For the GOED research, I'd be remiss if I didn't call out the excellent contributions from Aldo, from Ellen, Harry, and Caitlin in terms of supporting and helping design this research. So, key messages. Interest in personalized nutrition is high. It's really moving from being more of a niche opportunity, and testing is part of the creation of many personalized nutrition and supplement programs. The GOED-sponsored research across 5 countries also showed that interest in testing to know omega-3 levels is high as well. Interestingly enough, we found that consumers actually prefer testing at home using a finger prick blood test method to all other methods. And the benefits that consumers are seeking vary by country, but the ones that consumers prioritize are all ones that are consistent with the science of omega-3 fatty acids, suggesting that the message is getting through and that those benefits are motivating. Finally, our research suggests that there is an opportunity to grow omega-3 supplement sales by targeting diagnostics, and I find this very interesting, to consumers that are already confident that they're getting enough omega-3 in the diet. In other words, they're taking proactive steps through diet and supplements and want to see that they're making progress. Beginning with our research at Enlumen, we screened a large sample, over 5,000 US consumers, all adults, and found that actually 57% were interested in personalized nutrition. Among those interested in personalized nutrition, we had a high cross-reactivity with those that were interested in personalized supplement programs. A little over 85% of those were also interested in personalized supplements. Nearly half of the people that we spoke to that were interested in personalized supplements are participating or have recently participated in a personalized plan. What is interesting about personalized supplements versus personalized nutrition is if you talk to consumers that have participated in a personalized nutrition plan, really what you see is the majority of them have participated in it for 6 months or less. When it comes to supplementation, the majority have actually participated in it for 7 months or more. Why is this? We think it has to do with the fact that a supplement regimen is much easier to follow than providing recipes or trying to follow a detailed dietary advice. In addition to that, supplements don't have the risk of being isolating, like a very restrictive diet might have when you're trying to feed your family. We also found that more than half of consumers that had a personalized supplement plan had or used existing testing as part of the creation of the plan. You'll see very high numbers around a blood test in a lab or office or a urine test. And we believe that this is probably either the consumers or working with a company to use existing data like that would be collected at the general practitioner's office to help to develop that plan. But then you also see answering a survey, hair or nail sample, blood test at home, genetic test, breath test, microbiome test, in surprisingly high numbers. 20 to 25% of people participating in these. This is quite, again, and this shows the rise and the change of interest in testing, broadly in personalization. If I went back to 2015 when we started Habit, the numbers of people that were interested in or potentially participating in a plan were in the single digits, even lower than that when it came to testing. So we're seeing a very rapid rise in a large and rapidly growing market. So what are the key insights from our Enlumen research? Interest in personalized nutrition is high. If you do the math, it's about 1/5 of all consumers surveyed are actually participating in a personalized supplementation plan, suggesting a growing market for personalization to differentiate supplementation offerings overall. For those participating in a personalized supplement plan, over half had testing included as part of that plan. And testing is only expected to become more utilized as interest in personalized nutrition grows and becomes more accessible. So this is just a small part of the research that we've done. If you're interested in more details on this report, please reach out to me, or you could go to www.enlumen.com and download a copy. Let me switch now to the GOED-sponsored research. And again, as a reminder, this research is designed specifically to help to address key questions and identify an appropriate consumer target for omega-3 testing. So what are those questions that we're trying to address? Are consumers interested in testing omega-3 levels? Is there a preferred testing method that they're using? Who is most interested in testing? What are the benefits they're seeking? How large are interested segments? And who will start taking or increase supplementation if their health levels aren't optimal? So let's start with interest in testing. We tested 5 countries, US, UK, Germany, Australia, and South Korea, with a cohort of 1,000 or greater for each group. If you look at top 2 boxes, those that were definitely or probably interested in testing, you see that it ranges from the mid-60s to the high 70%. So we see a lot of people that report that they are interested in testing. Now, obviously, reporting and action are 2 different things. So we take that in consideration as we go forward. But I think it's encouraging to see that interest in testing is high. Throughout my time working in personalized nutrition, I've often heard anecdotally that people are concerned about needles, and oftentimes, particularly self-testing. But what we saw is that finger prick testing at home was actually preferred to digital dietary intake surveys or blood draw from a lab. Now, across the board, there were some areas where it was equal. In the US, finger prick testing at home was equal to a blood draw from a lab. In Germany, finger prick at home was equal to a digital dietary survey. But in every country, the finger prick at home was either first or equivalent first for each area. The top reasons for testing also varied somewhat across country, but you had good alignment in terms of what were the top areas. And notice these areas: improving heart health, preventing or managing chronic disease, improving or optimizing brain health, promoting overall wellness. All areas that are well supported by omega-3 fatty acids. And it also, I think, highlights that some of the positive benefits that, that are in research and that we've all been communicating is reaching it to consumers. I do think it's important to also consider why people might not be interested in testing. And the top reasons for not testing, and this was the top one for the US, UK, and Germany, is I haven't heard about this testing before. So this is an important opportunity, is just the availability, the access, and the quality of testing to help people make informed choices. The second bullet, I want my doctor to recommend this test. In Lumen research, one of the things that we see is that doctors are the most trusted source of information, even though people typically go to Google first. We also see that 2/3 of consumers aren't getting the level of support they need. So being able to have some expert endorsement, direct or passive, to have a knowledgeable person that they can talk to, could be a very important point of converting people to testing. And then in Korea, the top answer is, I'm not interested in this information. So we have to accept that this isn't going to be for everybody. In terms of who is a likely target for testing, when we went into this research, we really went in with the idea that the people that would be most likely to test would be people that haven't tested before. They would want to know their numbers. Or people that weren't confident based off of their diet. And it's actually quite the opposite. It's the people that are most confident that they're getting enough DHA and EPA already. People that are taking steps to improve their diet or to supplement. They're looking for reassurance that they're doing well. One of the questions you might ask with this, because you see significant differences in percentages with respect to confident and not confident in terms of interest in testing, is it a large number of people that are already confident? So in every country but one, the numbers between confident and non-confident consumers that we surveyed were roughly equal, 1-to-1. In the US, we exhibit a very high degree of confidence. It was 2-to-1 that they were confident they were getting enough versus not confident. Now, we know that I don't know anywhere in the world where 50% of consumers are actually getting enough DHA, but we do see that we have high levels of people that are confident that they're getting enough and interested in testing for reassurance that they are. So this is another graph that is among those that are definitely interested in testing. A number of consumers reported that they would also increase supplementation if they weren't getting enough. So here what you see are current supplement users that would increase their dose, and we also looked at non-supplement users that would start supplementing. So amongst these non-supplement users, we're also able to then look at those and break them into confident or non-confident, as well as whether or not they're taking proactive steps to improve their health. But approximately half of the consumers surveyed in each country stated they would also make diet changes or talk to their doctor, nutritionist, or dietitian. So we actually did this exercise with each country that we looked at. I'm using US here as an example, as a large market, but really the thought and the percentages that go into each are very similar. So we started with each country, the eligible adult population, those 18 and over. We then said, what number of consumers are interested to know levels? And you might say, okay, that 28.6%, well, that's much lower than what you had. Based off of Katie's experience doing extensive market research in the food and nutrition industry, what she has found is that those that are definitely, they're the report to be definitely interested in doing something, about 50% of them will act. Those that are somewhat or probably interested, it's about 15%. So we applied those discount factors to be conservative, hence getting at that 74.6 million. We then looked at current supplement users and potential supplement users and adjusted for people that would never take supplements. So based off of that, that number falls about 15% if you look at 41.8 and 24.6. We then looked at the consumers that stated specifically that they would increase or start supplementation if their status were low. And then we looked at consumers who would need supplementation. Now, we took a very conservative estimate here of a range of between 50 to 75%. I think all of us know that it would likely be a larger group than that. And then we finally looked at the number of consumers who would act on results. And again, so this is another discount factor, because as we were talking, I think Aldo from the GoEd team, Barbara from my team, both were like, look, we've already discounted this, but the reality of it is that the people who actually act will probably be smaller than you think. So we said we cut it in half one more time. Even with that, though, you have an estimated market size of 11.1 to 16.7 million consumers. And you might say to me, well, what does that look like, across the different countries? In all 5 countries, it was about 10 to 20% of the consumers interested in testing to know levels, and between 4 and 7% of the eligible adult population. So this suggests that there still is a large untapped market where testing could help to drive increased supplementation or dietary changes. So again, what are the answers to the questions we explored? Are consumers interested in testing omega-3 levels? Yes. 2/3 of consumers report interest in testing. Is there a preferred testing method? Yes. It's a finger prick test at home. Who's most interested? Interestingly enough, people that are already confident that they are getting enough omega-3s. What are the benefits they're seeking? Heart health, wellness, brain health, and managing chronic conditions. Things that having the right level of omega-3 can be very important in terms of influencing health outcomes. How large are these interested segments? We estimate that about 1/4 of consumers across all countries would be interested in to know their levels. And who will start taking or increase supplementation if their results aren't optimal? It's about 38 to 79%, depending on the country, that would supplement if their results were lower than expected. So, key takeaways. Our research suggests an untapped market opportunity for testing consumers who are confident that they're getting enough omega-3s. There's strong alignment between clinically supported benefits and motivating health outcomes for testing, suggesting that target consumers understand and are motivated by the health benefits of omega-3 fatty acids. And finally, raising awareness about the availability of omega-3 testing services and target levels for health benefits is an important opportunity to help drive diagnostic testing and increase omega-3 intakes. And so again, personalization, the personalized nutrition marketplace in the US alone is about $7.8 billion. If we look at that globally, it's about twice that. It's growing at 10 to 15%. So I believe that there's a big opportunity to bring personalization through diagnostics to help to drive increased omega-3 supplement sales and improve population health. And I think that desire is only going to increase in time. It's really personalization is moving from being a niche opportunity to really being more mainstream with health and well-being consumers. So with that, I'll pause here, and I think we'll move into the next section of the talk. Thank you.
Have a seat. Have a seat here. I'll take this. All right. Well, thank you very much, Josh. Get our panelists settled here.
Oh, okay.
We have assigned seating. Otherwise, your microphone won't work. So that was a good overview of, again, the broad perspective on personalized nutrition and some of the consumer research that we did, that GoEd did. But now we want to talk to somebody who's living this every day. So I'm going to turn it over to Marjorie, who is, from Nestle, and she has been working with this for several years now. So I want you to talk about why you started this program and give us some of the details, and we'll go on from there.
Yeah, so thank you, Ellen. Thank you, everyone, for this opportunity to be here and to tell a little bit about our concept and about the learnings we have got along the way. It's maybe good to tell you that we launched our concept as a kind of a market test in a kind of a startup kind of way, so that we can learn along the way and also pivot along the way. Before I tell you more about the learnings and the why and what we have done, I tell you first what is the concept actually all about. Minami, my Omega, is actually designed to personalize omega-3 intake for all women prior to conception, during pregnancy, and during breastfeeding. So, and actually, maybe you would like to know is why did we actually get into this business? Is we really thought we had a kind of a strong why. We aim to minimize the risk, and minimize the risk is really talking about prevention of preterm birth. So really strong evidence about that. And we can maximize health benefits for mother and baby. Now, we all know the EFSA claims of the health benefits for mother and baby. So based on that, we thought we had a great concept. So, and then how we have done is, now, Omega-3 Diagnostics, that's why we're all here. We used the diagnostics of Omega-Quant. We reached out to Omega-Quant. You're using their prenatal DHA test and the mother milk DHA test, and we connected that with a patented algorithm we have developed, or Nestle Research developed that one. And together we can come up with a personalized dose recommendation. So yeah, that was quite a strong concept, and it's to tell you a little bit like how the customer journey is working is very simple. Consumers buy the test kit, they do the test at home, easy. They send the test to the lab. They register themselves online because otherwise you cannot get your email with your results. They ask they answer some simple questions for the algorithm to load, something like what is your weight and what's your due date, these kind of things. And then within 2 weeks they get an email with their report from Omega-Quant saying what their omega-3 level is, if they are low, medium, high, and attached to that our algorithm gives them their personalized dose. And then they can simply buy their dose they were advised to give.
Okay. And so talk a little bit about the progress. Let's start with the good news, the success stories that you've had.
Yeah, so our learnings, I already mentioned that we did it a little bit in a kind of a startup way approach. And we thought women in maternal stages are really open and really eager to search for information, willing to listen. So we thought our route to market would be to do it the direct-to-consumer way. So we set up an e-commerce platform and try to inform and reach out women in the UK this time to to ask them to start testing. And what are the learnings from that, actually? We already quickly came to one big hurdle, actually, and that's a hurdle for probably everyone, of all of us, is that you cannot say everything you want to a consumer. You only have to keep to the EFSA claims. So we could communicate the health benefits, but actually the really strong why, what we thought was strong, is the prevention of preterm births, we actually cannot say. So that was, already what we thought, is a missed opportunity. And the other thing is actually that there's still, although we could quite explain, the health benefits, we thought it was enough, still the conversion was low. And we didn't know why. So the only thing what I could think of is then reflecting to myself in the time when I was pregnant, that maybe they are not convinced enough, and maybe we need healthcare professional buy-in. We need the healthcare professional to reassure the pregnant women that if they ask, is this something, do I need to test, is Omega-3 something for me, that they are reassured. So then we pivot. So we thought, okay, let's go to the Netherlands, because I'm from the Netherlands. I have a great colleague here, she's here, Geke. She has a big knowledge of the maternity market in the Netherlands. So I said to her, let's do this together. While rebuilding our platform to the Netherlands, let's reach out to healthcare professionals and tell us about our concept and to get the first insight and what everybody think. And the good learning is that 100% of all people we talk to, like gynecologists, midwives, nutritionists, and even the professor, chairman of the guidelines in the Netherlands from preterm birth, they all said, go for it, 100% positive attitude towards this concept. They say your science is really strong, your concept is really strong, please go ahead. So that was really promising. So we were, of course, really happy with that result. And then we asked the second question for those who were interested, say, okay, but then would you like to test with us? Would you like to start prescribe the tests for your clients, for pregnant women, for instance? And then was also very good learning. Those healthcare professional practices who were interested in actually start testing were actually the ones who are already health and nutrition minded. Mm-hmm. So only those were the early adapters. Those say, okay, we start testing. And all the other ones say, you have our blessing, please go ahead, but I wait for the guidelines. Right. Or I don't have that much time, or these kind of things. So, but also we thought it's good. They say, really, you can reach out to our consumers. We will support you.
Well, I guess I would say that was a surprise when we did the consumer research that GoEd did with Josh. We were surprised to learn that the consumers who are already taking omega-3s or are already nutrition-minded, like you said, are the ones that are more willing or more open to this. And Leyland, I know you have some comments on that too from work you've done.
Yeah, absolutely. I mean, I think that if we look at the individuals that are interested in the test, are the ones who've got some skin in the game. So those who are taking omega-3 supplements, are curious to know what their results are, or perhaps even those who don't take supplements but may be thinking about pregnancy or something, so they learn a little bit about the topic and they might be curious about their results. But then you have these other subset of consumers or individuals who may have an underlying medical condition, for example, high triglycerides, or they might have dry eyes. So the healthcare professional might, in order to dose them or give them the correct formulation or the dose, they need to know what the status is. So usually the individuals that are taking some form of supplement, omega-3 supplement, or thinking about moving to this space are the ones that are most curious about their levels.
Right. And Omega Quant has done a ton of research. Many of you will know the name Bill Harris. So Bill Harris and his colleagues have done so much research trying to connect the omega-3 index or omega-3 testing to positive health outcomes. So talk a little bit about if that makes a difference or how that works with.
Well, it does. I mean, Nestle is a great example here, because how often do you see a multinational like Nestle being first to market in this category for test-based nutrition, for early life nutrition? And that's really based on the research out of Australia is South Australia, so it's not part of FARI, but we're closely associated with Bob and Maria there. So they're part of the South Australian Medical Research Institute. So they found in their publication from a few years ago that pregnant women who are low in their omega-3 status, which is a critical thing, reduce the risk of preterm birth by 73%.
That's
significant.
a huge number, right.
So of course, Nestle sees this research and thinks, well, how do we translate this? How do we get this onto the market and the approach that they're taking? Again, another fundamental issue that we have in this category is even on our behalf, when we publish papers, we have one outcome, regardless of the number of subjects in the study. But we know that everyone's different. We see differences in gender, age, weight, even genes. So this whole personalised nutrition category is really critical because quite often these individuals who are supplementing, they're following the advice on the label, take 1 or 2 capsules a day, but often it might not be enough. Mm-hmm. So to be able to go back to them and say, well, based on your status and based on the formulation, here are the recommendations in order to get into that optimal zone. Some other research, again, this is just high level. FARI, let me have a look. Back to Bob and Maria, right? So
Bob and Maria, so just why don't you explain who Bob and Maria are for the audience?
So Bob and Maria are one of the leading researchers on omega-3s for early life nutrition, really focusing on preterm birth. So they've done some of the biggest clinical studies in the world. There are others, Susan Carlson in the US are also done a huge amount of work in this area. But Bob and Maria, not only have they done this research, and it's also been accepted by the Australian Government Pregnancy Care Guideline, where they've changed the intervention or made a recommendation where any pregnant women in Australia should take omega-3 supplements in order to reduce preterm birth. And they've actually gone one step further. So now in Australia, in South Australia, since the start of 2023, all pregnant women are being screened for their omega-3 index or status. So last year they've screened 16,000 pregnant women, which is about 60% reach. So there's still 40% of women that they haven't been able to reach, but that's year one.
Yeah.
Right.
So hopefully next year we'll see that increase, and hopefully the Australian government will roll this out to be a national program. And this is pioneering. It's the first time anything like this is being done. So it gives us a lot of confidence that the science is very strong here. There's a lot of good research behind it, and hopefully we'll see other governments follow in the footsteps.
Yeah, I think it's fair to say this is unique. If we go back to healthcare practitioners and talking about acceptance, it's not very common that a doctor is thinking about an omega-3 test, or it's just not part of their paradigm, right? I mean, we talked about this as we were talking about what the obstacles are, which we'll get into in a minute. But I guess talk a little bit about the healthcare the challenges within the healthcare community. Maybe I don't know if any of you have a particular comment on that. It's not widely accepted in the medical community. Most doctors will most doctors wouldn't be interested in the fatty acid analysis. If they are interested, they're particularly interested in the omega-3 and omega-6 ratios. Right. But that's based on some research from the 70s, and it's kind of stuck in the medical community. But for us, we think that the omega-3 index is a much better biomarker and more clinically relevant than the ratios, because I'm not sure, we've tried over the years to get people to reduce their omega-6 levels, but it's really difficult to do. It's so much easier to do it by increasing their omega-3 intake in the enclosure ratios. So it's still a long way to go, I think, but we're seeing certain countries, South Australia, we're seeing Germany, that are accepting the omega-3 index as a medical report. We're seeing Switzerland now accepting the omega-3 index as a medical report. And hopefully this momentum will continue. Well, I said at the beginning of this that we wanted to talk about obstacles also. So we, as I said, have been trying to figure out what we as GoEd could do to further the conversation about diagnostics. But we keep talking about, well, there's all these things we have to figure out first. So Harry's going to talk about all the problems.
Thanks, Ellen. For those in the room that know me, that's a good topic for me. But
regulatory.
But after the plenary session from the first day, I'm changing this to frictions.
Frictions.
So I'm trying to be a little bit more positive.
All right, excellent.
So I see two challenges. One from a testing approval process or a testing approval and then also a policy. So testing approval, it's not a foregone conclusion that you can just take a blood sample and analyze for omega-3s. And so I know in Europe, recently there was a regulation for in vitro diagnostic testing. It came into effect as of, I think, May of 2022. In the United States, there's a notice of proposed rulemaking for laboratory diagnostic testing. Some thought that that may come back as a final rule as of April, but it's not clear as to what the requirements are going to be at that point in time. It could be that the omega-3 testing could be regulated as a medical device. And I'm putting that as a worst case scenario for that. And if that's the case, then it's going to take quite a bit of work to get these tests approved. Eventually they will get approved, but it's just a matter of time and money. From a policy perspective, I'm thinking specifically about the United States and Canada. For dietary reference intakes, there's a strategy or a framework for setting dietary reference intakes. And one thing that's mentioned in that strategy or framework is that there has to be a validated biomarker. It begs the question as to what validated is. Of course, the omega-3 testing is validated, but is it validated the way the governments of Canada and the United States want them validated? I suspect this will be taken up by a committee. It's called a Standing Committee of Dietary Reference Intakes, and they'll debate that. As far as I'm concerned, we really need the data from observational studies in order to set a DRI for EPA and DHA in both US and Canada. Without the observational data, we're left with a lot of RCT data that's been conducted in basically secondary prevention and would be an unhealthy population. So.
Right. Which this is, I guess, a little bit of a segue into the science, because we talk a lot about the science that has been done on omega-3s, and sometimes the science might be neutral. And the challenge is, if you don't know where you're starting, how do you know that if these particular people need to make an improvement? So, I mean, I don't know, Josh, maybe you wanted to have some comments about the scientific baseline.
Yeah, I think that's, I mean, it's building a bit on what Harry was saying in terms of building the science. And this is also an important call for action for diagnostics, that if you don't have the measurement to establish your baseline, how do you understand the relative change? And in some cases, how do you establish objective levels for where somebody should be for a particular outcome? One of the things that I think could be very interesting as we're thinking about this both from a science and a policy standpoint is by having a baseline and demonstrating that change and then tying it to specific outcomes, such as being done in South Australia with preterm births. I'd have to think it's almost a no-brainer in terms of reimbursement when you think about what is the cost associated with a preterm birth, not only for care for that infant in the short term, but when you think about situations like lung problems or retinopathy of prematurity and the burden on the healthcare system, it underscores the importance of diagnostics, whether you're looking at it from a medical application or a more consumer-based application. So Harry, I don't know, I mean, I know you and I have had a few conversations about the importance of this. I don't know if you wanted to add to that.
Yeah, off the top of my head, no, I don't. I'm suffering a brain freeze. I apologize for that, Josh.
Well,
But, yeah.
go ahead. No, go ahead. I was going to say it's a big frustration for us in the industry that we can see that this should be something that we could work with and get people to understand, and whether it's the scientific community who's not doing the right thing when they set up a scientific study, or it's the education of whether it's consumers or practitioners. I mean, all of those things are part of the challenge.
Yeah. I guess the only other thing I was going to add to it, it's just that the problem with too many studies is you don't have robust measures of intake to start. And so having that at the beginning in association with health, and then having it with the association of outcomes at the end, or associations with other markers, are what is going to allow for a robust and validated biomarker system to enable the types of applications that I think we all want to see. in an ideal world, right, that is going to be something that's going to be administered as part of healthcare, and it's going to be something that's going to be tied to a standardized recommendation in any country. But this is where we need to have that integration. I mean, I think it's not just a matter of consumer attitudes towards personalization. It's a matter of moving the field and recommendations forward overall.
Right. Well, let's get back to the test itself, because in the consumer research that GoEd did, we saw that people were open to a blood spot test, which was somewhat surprising. I guess it depends on what if you're looking for simple and then you want a food frequency questionnaire, or if you're looking, well, I'm already at the doctor, I'd rather have just this part of my blood draw. But I guess I want to talk about, maybe Josh, for you. To me, it's a little bit of a disconnect, because I do this and then I have to wait a while for my results. Like, what can we do to kind of reconcile those two, that people are willing to do this, but then we hear from other people that, well, it takes too long?
Yeah, so there's a couple things, and this really comes back to personalization overall. You never want to ask more of a consumer than what you're willing to give. And some people are willing to put out more money and be more patient for the results, others aren't. So it's a matter about how do you build that engagement and kind of take them on a journey with you. So as you saw in the personalized supplement research, the digital survey or online survey is a very common and well-accepted tool. There's no reason whatsoever that you couldn't provide somebody with a digital survey. It's not going to be, because of all the factors that can affect how the omega-3s are going to be utilized, it may not be a robust level of intake, but you can start to give them feedback right away and give them something that they can use in terms of impacting their diet or to consider for supplementation. I would then use that type of engagement then to say, look, here's all the reasons why a dietary survey may not be ideal. You may want to consider a test. So it's a little bit of sort of that next level up model. And we've seen that type of, if you want to call it freemium or premium service, work well with a number of companies in personalized nutrition as they move through different levels of testing. Oftentimes starting with surveys, sometimes then integration with things like wearables and blood tests, and oftentimes then moving on to sell their own blood test. But it creates an engagement cycle and a relationship to help to drive it. The second thing that I would say is leveraging an outside expert or an influencer. And I think particularly for this space, you're going to want to have somebody that has a credible evidence base behind them. Influencers, as we've heard, are a meaningful way to help to drive engagement and products. And the third thing would be building in community. It may seem a little counterintuitive that you want to have a sense of community and personalization, but having somebody that would be, another person that would be low in status that you're testing with, whether it's making it competitive or simply holding people accountable, is a way that you can help to convert that use of the diagnostic. And an important way that you can go on a journey with somebody together in terms of improving their nutrition and health, whether that be agreeing to hold each other accountable for supplementation, improving diet, or both.
And Leyland, you've done a really good job in the last year of growing OmegaQuant's business outside the US. So obviously you've had some of these conversations with customers or consumers. What do you have to add?
I think convenience is also another thing, value proposition. Mm-hmm. We use dry blood spot cards. They've been around for 50, 60 years. Governments use them to screen newborn babies and test their population for various diseases. So much like fatty acids as a raw material, and you add antioxidants, we also have to use antioxidants on these filtered paper. But this makes it really convenient for the healthcare professional to be able to treat patients that might be remote, or perhaps it's a population that doesn't have a clinic close by. So I think having these tests more accessible to the general population is really important, and I think the dry blood spot format is ideal for that, because traditionally you would have to go to a doctor and get a blood draw and pathology lab and so on and so forth. So I think that's important. I think some of the things that we're looking to do now is make these test kits more accessible direct to consumers. We see a huge increase in that channel where consumers, I think generally speaking, are more savvy about nutrition, becoming more me-centric rather than buying in multivitamins, where are my deficiencies and what can I actively or proactively do about this? And I think this will increase. So I think if we look at our 4 channels of the business that we're in the research, clinical analysis, healthcare professionals, they're fairly steady, but the growth is really coming from retailers, B2B businesses, brands, as well as direct to consumers.
Okay, excellent. Well, so before we open it up to audience questions, we talked a lot about obstacles here, but I would like to ask the panel, in each of your opinions, what do we need to do or what needs to change for this to be successful in the future? And so Josh, I'll start with you.
Yeah, I think I'll come back to the point about sort of that cost-benefit analysis. I think particularly, coming back to healthcare and overcoming maybe some of the past bias against it, it's just being able to kind of show that the benefit or the cost avoidance. And I think that if you're looking at preterm births is an excellent place to start. So I think that's one important part of it if we're looking at it from a medical adoption standpoint. From a consumer standpoint, I'll actually kind of come back to the point that you're touching on, Leyland, but maybe in a little bit of a different way. It's kind of the accessibility. We're going to fast come to a place where people are competing from a personalization dollar standpoint. I think personalized nutrition is going to continue to gain traction, but getting the value equation right is going to be important. Cost is the number one reason that people stop using personalized nutrition systems. Support is really the number 2. So really getting that value equation right. And we also need to kind of make sure that we are doing a good job of expanding available data sets. Access is in part based off of cost. Access is in part based off of making sure we have representative data. I think one of the advantages of studies that look at omega-3 intakes or levels is it's definitely more widespread than a lot of the others, but as we saw in the talk yesterday, it's still predominantly European, Caucasian. We need to expand our data sets to make sure that the information that we have is representative so that people from all different areas, we know that the benefit is robust. That'll also help to kind of change the discussion as we get into the medical community and assuring that it's right for everyone.
Audrey, what about you? What do you think needs to change?
Ideally, guideline changes. Because in the end, that's what the discussion always refers back to. And then secondly, of course, claims that we can say more, that we can educate more, that we can tell more. And there's so much evidence, so please let us say more to the consumer. So, because the reason why they sometimes not do the test is because we're not selling a product, we're selling a solution to their problem. And if they don't see the problem, so there's nothing to sell. So yeah, so educate still, and indeed that we could say more to them. Yeah, that will help a lot.
Good point. Leyland?
I think having standards would be good for the category, not just on health claims, but also from analysis. I mean, let's not forget, omega-3 is fatty acids. It's only been around 50 years. If you compare that to vitamin D, it's been around for 100 years, so they've got a head start on us. I would like to see more and more labs offer this. Mm-hmm. The more labs that offer it, then the more consumers can access that analysis and don't have to wait as long to get the analysis. So again, I think it comes back to accessibility, and having this test more available to both consumers as well as other labs who may want to offer it in their country as well.
Harry?
Going outside my comfort zone, which regulatory, I would say that results, the way they're reported, need to be standardized so there isn't confusion by consumers. Omega-Quant, as far as the research is concerned, Omega-Quant has, with the Omega-3 index, has the most out there, but there are other testing protocols and results that they're there. If it can be standardized, if consumers know that, and there's a sort of a metric that they can become familiar with, then I think that will really help. And I know when we were all discussing this panel, we talked about blood pressure. People know that they need to keep their blood pressure under a certain level. And I think here they need to know that they should keep their omega-3 levels above a certain level. And again, omega-3 index, I think they're familiar with that, but if the other results can somehow be compared easily, I know there's been work on that.
Right. Well, and I guess we somehow missed talking about the fact that GOED is about to publish a white paper on the state of omega-3 testing. And Josh, maybe you just want to talk about a couple bullets from that, because that goes to Harry's point that there's still other tests out there, and is there some kind of, how can we make sure that they're all talking in the same language?
Yeah, sure. So there's really two parts to the work that we've been doing together. One part of it has been obviously focused on the consumer research. The other part of it is a scientific white paper. And really the idea behind that white paper is to do two things, to kind of talk about what is required for a valid test. And so it reviews a wide range of different tests and where they may or may not be appropriate. No surprise at all, just as Harry is saying and as we've been talking about, Omega Quant is one of the scientific leaders. But as I said earlier, there's a lack of consumer awareness around testing, let alone like the types of tests and what they mean and how do you read them and how do you standardize it. So the purpose of this white paper is really to kind of help the reader to kind of walk through what's available and what should be considered as part of that. The second part of it is kind of aligning diagnostics with measures. And I think that's also one of those big challenges, because while there's a lot of association of what are the benefits of omega-3, being able to link those back to diagnostics isn't quite as strong. So really what we've tried to do is kind of focus in on where there's the best evidence and linkages to diagnostics. But in the way, it also provides sort of a guide of where we could lean into. And one of the things that's really nice between the white paper and the consumer data is that, and not necessarily a surprise, but those best, the best supported benefits with the links to diagnostics are also the ones that consumers speak to knowing about. So that's been submitted to the Journal of Nutrition, so hopefully that'll be coming out in the not too distant future. And then it will be a very nice communication package around diagnostics for both the science and the consumer standpoint. And admittedly I'm biased, but I think it's an important opportunity for GOED to be able to lead the way in this space.
Thank you. So we do want to open it up to audience questions. And for anyone on the GOED team, I don't have the app, so can you also look and see if there are questions in the app? We have a question over here. They're just grabbing the microphones.
And one up here.
Okay, good.
Hi, I thought that was a super interesting panel, so thank you all for your contribution. I just have this sort of a two-part question. So wondering if you kind of touched on it just now about do you have in-house labs or are they third-party independent laboratories? And then the follow-up question was, how do you convince the consumers or make them comfortable that you're not just trying to sell products, talking about kind of the validity of the test results and that they can actually trust the results from their diagnostics test? So
I start with Leyland.
Yeah, so I'll take the lab question. So we have our own labs that we operate. Again, we talk about standards. There is no standards when you measure fatty acids. We published the first paper on the omega-3 index back in 2004. So we operate in all three regions, in the US and Asia Pacific and Europe as well. But we also collaborate with other labs as well, where we actually give them our methods so that they could offer it to their customers. So it's a combination of both, but we certainly want to do more with the other labs.
Yeah. Oh,
Well, there was a second question.
Yeah, the second.
Yeah.
Can you repeat the second question?
Yeah, it was just about how to convince the customers once they get the results that it is actually, like how you were talking about the standardization kind of, that it's not just, you're not just trying to push products on them, right? And this personalized nutrition is actually obviously going to benefit their omega-3 levels, for example, or like the index.
Yeah, it's also, that's why it's important that it combines the lab report with the results, because the lab report, it tells you if you are low or if you are in a mid-range or in a high range, so that already automatically explains you need a higher dose or maybe you're already in the correct position. So then you can see also a recommendation is really referring to that. So that's more or less that. But also, we really say we believe that you only take what you really need. Just test. So yeah, we actually even say for those who are really high, please don't take anything extra. But yeah, it's something you have to build trust in, indeed. The healthcare professionals do know because we explain that. So it's all about our storytelling to the consumer, and indeed, we have to find out as well, indeed, in the future if it's unbelievable. But so far, we didn't get that response back. Consumers thought it was really unique that they really had a personalized dose based on the lab reports. So, but yeah, it's a good thing. So, good question. So I will take it with me in my process. So,
well, and the lab results, they're connected to the science.
Yeah.
You know what Leyland mentioned that is going on in South Australia. It is really revolutionary, and the science is very strong. So it's just a matter of connecting the dots for the consumer understanding.
Mm-hmm. And the algorithm as well is also based on science.
Right.
Yeah.
Mm-hmm. Right. So here in the front.
Hello. My question is also for Marjorie. I think very nice presentation, very nice product as well. And I wonder whether when you went visiting physicians in the Netherlands, were they from the public sector, private sector, and also whether GPs or they were specialists? And did you see a difference if you did all of them?
Yeah, so the Netherlands is really specific. So let's say that the maternity market is in every country very different. In the Netherlands, we have really a midwife market. So 80% of all women who are pregnant go to a midwife and not seeing a gynecologist at all during their whole maternity process. So that's kind of a unique thing compared to Germany, for instance, where they're going to the hospital, I believe I've heard. So every country is different. So here we reached out as well to clinical midwives and also gynecologists. But in the end, we did test with the midwives, with their practices. And these midwives in the Netherlands most of the time have a practice with 3, 4, or 5 midwives in the practice. And sometimes they have even a nutritionist under the same roof, or a physiotherapist, or a lot of things. And we found out that these practices are the ones who's willing to test right away, because they have a nutritionist in the house. They are believing already in this idea, and they say, oh wow, personalization is key. And even now with in the days of sustainability, personalization is all about waste reduction. Why should you take something you don't need? Or they believe in it really. So also one of my learnings is to really start with healthcare professional, and hope that they come there in time, because especially with pregnancy, you have only 3 months, or the first 3 months you have to start to be able to be in time to get to the level you need to prevent preterm birth. So.
Well, and that's something also when you talk about what type of health practitioner, that's one question. What country are we talking about? When we as GoEd were talking about this whole diagnostic strategy, we said, well, are we working in the US where we have to go worry about insurance reimbursement, or are we trying to work with midwives who have a whole different way of thinking about things? So if you are trying to figure out what you can do as a diagnostic strategy, I think you need to figure out where you want to be first. And you can't do something in every country, or you can't even do it to a variety of different audiences. You have to start somewhere. And maybe this is turning into a question, because Josh, when we did all this consumer research, again, we've talked, what do we do now? So we have this consumer research, what's the next step? And I think it's doing a little bit of segmentation on who would be the target audiences that would make sense.
Yeah, and I mean, I think it's one of those things that's hard, it's a hard thing for GoEd to go after purely independently, right? Because when we get into this, you really do have to be thinking about, branded concepts, I think would be a very logical next step to try some of these areas out. I mean, because keep in mind that generally speaking, consumers aren't going to be buying just a diagnostic, right? They are investing in a benefit, some aspect of health. And with omega-3, sometimes other than things like, dry eye, those might be longer term benefits. So when you're looking at benefits, things as you're bringing up, cost avoidance could be very important. You're taking just the amount that you need. But I think you have to kind of look at it in a benefit ecosystem or a personalized ecosystem, whereby you might have a branded concept that would tie, the benefit, the test, the information, and the behavior change tool, the supplement or supplements, right? And I do think there's a lot of opportunity to be thinking about it not just in the context of maybe only omega-3, but other things that might be beneficial for a given area. And in this way, it would allow a branded manufacturer to be able to create a point of difference and also be able to provide potentially additional benefits to their user. But I think it can be a very compelling message in terms of that this can help to support some short-term impacts, like spending just the right amount of money or providing certain benefits, as well as long-term health. A really interesting thing that we found, and this is, so forgive me because this is only with the US consumers, but when we talk to people that are most interested in personalized nutrition, they actually had a slight preference toward longer-term benefits. And it seems to be driven, when you take that apart, it seems to be driven a little bit to what I'll call sort of the influencer culture. People that are interested in personalized nutrition want to be healthy in the long term. Part of that is for their family and friends, and part of it is to be an example for others. So I do think it's, this idea of it has to be a benefit I feel right now is evolving a bit. It's not that that's not important, but I do think there's an opportunity to kind of look at this more holistically and look at it in the short and long term. But I think what it needs to be to kind of really land it is tested directly. And I think that would be the key next step to move this forward.
And maybe just to add to that, I mean, I think the obvious channel is you've got your consumers that are trying to get some type of outcome from knowing what their status is and then going down the route of personalised nutrition. But what about all those consumers that are being just proactive about their health? They know to take omega-3s because it's good for them. They don't have any underlying issues. So for those consumers, it's important for them to test as well because they need to know some sort of validation that, hey, this is having a positive effect on my health, but I'm not feeling it. You don't wake up saying, oh, I've got high triglycerides or anything. With certain symptoms like dry eye, you might feel the benefit of joint or maybe mood, but heart health, you don't feel it. So I think it's important for those consumers to get validation that the supplementation they're taking is having a positive effect on their health, even though they might not feel it.
You had a question over here?
Thanks first for this very interesting session. Much enjoyed that. I have one comment I would like to make. I found it very interesting. There was mentioned that the guidelines was the primary hurdle for getting into this new market. And I was looking at the German guideline for preventing of preterm birth, which was issued at a time where the Cochrane review proving a 42% reduction in early preterm birth had been out for half a year. So it's been included in the German guideline committee's review of the state of science. And they just neglected it. And I found that amazing. And I think they didn't do it because they're bad people. They're just probably not enough into the matter. So I think there is an opportunity for the industry to try to work with the actual scientists, professors that work on these guidelines, because the guideline on preventing preterm birth will include dozens of items, including physical exercise and whatsoever. So you don't have the lipid scientists there who can actually make a qualified assessment on that. So that's a comment I would like to make. And another just observation, I go to the doctor regularly, and he's a good friend of mine. He's a general practitioner and a cardiologist. And so he takes a blood sample, I don't know, once a year and tests all kinds of parameters. So I asked him, please, can I have my omega-3s included? And he said, oh, well, I got to check with the lab. I don't know if we can do that. Yeah, I'll give you a call. So he called me and said, yes, it's possible. And okay, I'd do it. It's like, I don't know, €50 whatsoever. Okay, well, I'll pay for it. And Then I received a result on my omega-3 levels in the blood. I was asking for the omega-3 index specifically, so he forwarded that answer to the lab. What I received was an answer like, your omega-3 level is 16. And I was surprised, and I looked at the report and didn't even detail what method that is, so I have no idea what it is. I don't know what he tested for. And he's an intelligent guy. He's working, he's seeing, I think, a couple of thousand patients, and he even is a cardiologist. So I really think that we in this room, we've heard about omega-3 index up and down, and I just learned that a person at this table happens to have an index of 10, so perfect. But if you talk to practitioners who are drawing these blood samples and who basically advise patients on health issues, they have no clue. They would ask their lab, and the lab would do whatever whole blood test or whatever blood fraction they would test, and they cannot give you any assistance on that. On my vitamin Ds, I get a level, and I know I'm inside or outside the box, and my doctor will tell me this is what you got to do. With omega-3s, that's not the case, at least not in Germany. So.
Well, I was going to say that Germany is ahead of the US because the last time I did blood work, I asked, well, could you test my omega-3 levels? And this was at a lab, and they said, what? So, but if you got a test and you don't know what it means, I guess that's not any better. So we have a lot of work to do in many countries. Other questions from the audience? I don't know if there are any questions in the app.
Ellen, can I make one comment though about,
of course,
with respect to physicians and what might be a way to start, or enable the conversation further there. It's really doing, more than a test. There probably is some continued need to educate the associated benefits, because what the physicians will care about are the other markers. So if a person is doing supplementation, they're seeing changes in their blood pressure, their triglycerides, right? Those types of things can be meaningful. And that can help to be part of the call for diagnostics. Whether it's with physicians or with consumers, what we have found is that biomarkers can be meaningful proxies for end benefits, at least for a time. So I think this is where it gets a little bit more complicated. But having test systems that are integrated, or even for consumers being able to have results that they can share with their physician or speak to them about supplements, it can be very important. My physician doesn't do omega-3 testing, but is a big advocate of omega-3. So it's very interesting, that without any actual, testing or objective level, he, he's like, yeah, you absolutely should be taking your DHA and EPA.
Right.
So I'm like, and why do you say that? He's like, most people aren't getting enough. How do you know?
True. You have a good doctor, though. So, all right. Well, then, in that case, I will ask you to join me in thanking my panelists. I think this was a great discussion.
Thank you.